Great to see you, as always.
Great to see you. Yeah, thanks for sitting down together.
Yeah, you bet. So, talk to me about what's going on in the Bay with you. It's pretty exciting. It's awesome.
Yeah, so I've been in the Bay Area for my entire career, over 25 years now, doing primarily adult spinal deformity. And as you recognize, really optimizing our outcomes and operating on complex cases requires a team. It's really an interdisciplinary collaboration. Certainly, the surgeons are part of the team. We've also got our anesthesia group and our perioperative care team. I think a lot about optimizing a program in three phases. We think about our preoperative optimization of the patient, and we think about intraoperative standardization, doing the same things well every time. And then postoperatively, I call that postoperative phase accountability. So postoperative accountability is looking at the outcomes of what we do, not just in the short term, but in the long term, thinking about a lifelong perspective.
What have you learned as it relates to excellence and just like standards? And I don't know, it's hard to get there with surgery, but
Sure.
the pursuit.
Optimizing our outcomes is a constant goal. It's a goal that requires ongoing evaluation, auditing of what we're doing, and modifications. And to some extent, what we've learned a lot in all three phases of care. Preoperative optimization, we've learned a lot about our algorithms for the ideal alignment that we want preoperatively. We learned a lot about optimizing the patient and modifiable risk factors, making sure patients are coming to surgery in an optimized condition. That includes nutritional status, that includes blood sugar levels, that includes the utilization of pain medications, and that includes actually preparing patients to go home. So those are facets that we've got a team working on preoperatively to make sure that patients are coming in optimized. There are obviously often situations where we can't optimize. So trauma, tumor, infections, right? These are situations where we've got to operate on the patient as they come. But for discretionary elective surgery, which most of the time is what we're doing in the adult deformity population, we really have a great opportunity. What we've built and what we've learned is the importance of a nurse navigator to help us in preparing these patients preoperatively and having an interdisciplinary team, having our anesthesiologist engaged in preoperative pain management, having our discharge planning people think about where's the patient going to go postoperatively, actually arranging a rehabilitation plan before we get to the operating room. And that's made a big difference in terms of optimizing length of stay and getting patients home safely. The subset of patients who can get home or to an active rehab where they're engaged in physical therapy every day, those subset of patients do a lot better than patients who need to go to some type of a nursing facility.
Absolutely.
The next phase of care is intraoperatively. And again, having a spine-specific team we've learned a lot in that evolution in terms of how we manage fluids and bloods in the operating room, how we optimize our nerve monitoring, which is so important for patient safety, having the right equipment. So this includes everything from our nursing staff in the operating room to our implant representatives who are helping us with a broad spectrum of implants through the surgeons. And active engagement, one of the things we've learned is to really come up with our preoperative plan, again, part of our preoperative planning, and to share that before starting a case with our team.
Yeah.
Some of our team members, in fact, participate in our weekly conference to go through the cases in anticipation of what's coming up this week. And they'll say, oh, I remember talking about this case. I remember what we're going to do. Posting on the board our printed preoperative plan. Everybody's on the same page, knows exactly what we're going to do. And that's really improved our efficiency terrifically in the operating room. We've had less intraoperative need for transfusions, less blood loss, shorter surgeries, and less complications.
It's amazing. It's gotta feel great after this much time to get to this place where this is the pursuit of, it's not perfection, but mastery, right?
Yeah, it's really optimizing.
Yes, yeah.
And indeed, I don't think we're ever going to be complication free, but making our best initiative, our best efforts to optimize conditions. And then the final phase of care that I really focus a lot on as well is our postoperative care. So having an early recovery after surgery plan, getting patients up and moving early. We've shown definitively that helps with regard to pulmonary complications, that helps with regard to wound problems, that helps getting patients home. The The next thing is having a mobility team. So we've actually got special chairs in patients' rooms. We've got mobility specialists as well as physical therapists who are comfortable getting patients out of bed the same day as surgery.
Beautiful.
Early work with pulmonary care and center spirometry is important. Again, mobilization can also help prevent thromboembolic. And this really requires, again, an interdisciplinary team in the hospital. And then subsequently, looking at patients over the course of time is ultimately our responsibility is to improve the patient's assessment of their health-rated quality of life. So we measure that by function, how far can you walk? We measure that by pain. We measure that by other impairments, their social role, mental status. We're trying to improve every domain of health-rated quality of life. So measuring that, looking at what's the impact of what we do from pre-op to post-op, and making sure that ultimately that's what we're accountable for.
It's amazing. It's awesome. You gotta, I mean, how excited are you?
Oh, I think it's terrific where we've come. I still think we've got places to go.
Sure.
I think some of the areas I'm most excited about are bringing artificial intelligence and machine learning into some of our large data analysis. So again, looking at our preoperative planning, what is our ideal alignment? What's the goal of what we want to create? Is looking at different options and being able to actually simulate those options and actually predict
Right.
what the outcome might be with each of these options. There's almost nothing in medicine where there's more variation in how we do spine surgery. We got some of the best spine surgeons in the country here, and we're all learning from each other.
Right.
And if you show any specific case, what you'll see is there might be 10 different ways of doing that case. Or what if we could predict with accuracy which way is actually best? Which way gives us the best outcomes, is the safest, has the least complications, and it has the best cost effectiveness? Which one optimizes our value? And we're learning from each other with these interdisciplinary conferences. I think bringing machine learning into it can really create maybe a more standardization of what we're doing. I'm also particularly excited about what's happening with regard to postoperative care. Again, getting patients up and moving. We're actually talking about having a special facility for rehabilitation associated with the hospital so we can have really well-trained physical therapists in an environment that really is really attractive to patients coming from a distance.
Yes.
You know, our average patient travels well over 200 miles. We get lots of patients who are coming from out of the country, and having a place where these patients can stay postoperatively and really work rigorously to optimize their health status. So I'm really excited about the future. I think we've come a long way in 25 years, and I look forward to being part of this for a long time to come.
Wow. Well, root and yawn, can't wait to see it, and so grateful to be able to shine a little bit of light on what you guys are working on. It's exciting.
Yeah, thanks for your interest, and it really is a team effort. That's what optimizes patient care, is having an integrated team, and building that has taken some time, and I think we're there and still evolving.
Still evolving. Always kind of like that iterative change, trying to get 1% better every day, right? It's all you can do.
Absolutely. I always call it on the verge of greatness. We live on the verge of greatness. It's never perfect, but we're always trying to get a little bit closer. We're living on the verge.
I love that, on the verge of greatness.
Yeah.
Cheers to that, brother. Great to see you, man.
Thanks so much.